I'm speechless. I really didn't think that we were going to receive so much in terms of what we had expected. It was beyond our expectations.
Tonight, a healthcare center agreement in Quebec to serve all Cree Nations in the province.
We all as a family want to bring my sister home in the capacity that she comes home so that we can properly lay my sister to rest.
The family of a missing Metis woman in Manitoba makes a public plea for help. Good evening, welcome to APTN National News. I'm Dennis Ward.
And I'm Melissa Ridgen. This week, the Cree Nation signed a historic agreement with the Quebec government to fund construction of a state-of-the-art hospital in Chisasibi near James Bay. It will remedy the health concerns the community says that they've had for nearly 40 years. Lindsay Richardson reports.
The nation of Chisasibi, with a population of 5,000 and counting, is the largest Cree community in Quebec, home to a spectrum of growing health needs from birth to end of life that the community labored to provide.
You will see for yourselves that our little hospital is showing its age.
Chisasibi's current hospital remains nearly untouched since its construction in 1980. Its acute care facilities are limited. Patients needing surgery are flown at great cost thousands of kilometers away to Montreal or to Val-d'Or, whose namesake hospital is often criticized for its treatment of Indigenous people.
Entre le temps, j'ai rentré à l'hôpital pour des pierres au foie malgré mon insistance qu'on regarde mon dossier et s'est déroulé 14 heures. 14 heures avec une pierre au foie qui est active, fait très mal, je ne souhaite pas ça à personne.
But with this recent announcement, the situation is about to change.
The new facility will be the first regional health center in the USG, located in Chisasibi. It will serve all Cree communities, providing access to specialized services that it has not been possible to provide before.
A historic tri-party agreement signed this week by provincial officials and representatives from the Cree Nation will allow, in part, for the construction of the $300 million state-of-the-art Innu Health Center, making Chisasibi the destination for top-tier health services, even for those in neighboring communities.
I'm speechless. I really didn't think that we were going to receive so much in terms of what we had expected. It was beyond our expectations.
Bella Petawabano, chairperson for the Cree Health Board, says that acquiring necessary resources is an uphill climb with gradual improvements. Construction of the new hospital, she says, will cover the gamut of needs as far as traditional care is concerned, while also creating jobs in construction and operation.
As we look into the future too, we want to think that we're going to have more and more Cree who are going to be not only managers of or administrators of our organization, but also the professionals that we so need, like doctors and nurses.
The proposed 52-bed hospital will offer dialysis services and, for the first time in the region, oncology, surgery, CT scans, mental health services, a sleep lab, and an improved gynecology clinic. The latter the answer to a decades-long concern about women giving birth far from home, a concern validated by the province's health minister.
In addition to fostering a more autonomous Cree Nation, developing these local services will gradually eliminate the need for locals to travel south for care.
Slated for completion in 2025, the hospital will be a centralized and culturally safe alternative for all James Bay Cree. Lindsay Richardson, APTN National News, Chisasibi Cree Nation, Quebec.
Now for an update on a man who was refused to be assessed for a liver transplant because he hasn't been sober long enough to meet British Columbia's requirements. APTN's Tina House has that story.
Although David Dennis appears healthy, he's still in desperate need of a liver transplant. Despite going through numerous assessments and presenting his case to see if he can be put on the transplant list, He's still not officially on that list and still needs to see 3 more specialists next week.
There is no list until you go through a pre-transplant screening process, and that includes blood work, liver work, MRIs. They take a look at your heart, your kidneys.
For David, time is ticking. He was given just 3 to 6 months to live when he was first diagnosed with liver failure last April. However, since moving into this hospice, he says his life expectancy has increased. It's a tranquil setting where David says it's drastically improved his health and outlook.
Yeah, so this is where I've been staying. I've been here for 6 weeks, as I've said. Each room, everybody has their own room, their own bathroom, electronic bed. This the thing in particular is my favorite toy. Isabella's favorite toy as well. You know, he gets your ups and downs. And
Isabella, being the youngest of his 5 children, featured in this photo that he carries with him. He knows each day is a gift because others aren't so lucky.
I have my uncle's ashes, and he died from the same diagnosis that I did, but he died in hospital, and he was told at the same time that I was. So there's still cases that are out there like that.
Tonight is a celebration of life for David. Dennis is a former president of the United Native Nations, the Frank Paul Society, and is no stranger to leading the fight for Indigenous rights. What's unique about this celebration is that David is still alive to be here to see his friends, family, and community leaders who came to show him their support.
We're going to be bros for life, and I'm very honored, and thank you for changing my life.
3 months ago, David Dennis held a news conference to announce that he was launching a human rights complaint against the BC Transplant Society and the BC government. It's because of a 6-month alcohol abstinence policy before being put onto the transplant list. Dennis didn't qualify. After the story broke, the BC Transplant Society said there was a misunderstanding and that they had removed that policy last May. But according to Jason Grattle, who is representing David, he says that's not true, and it's a lethal form of racism.
David's health records pretty clearly show that the 6-month abstinence policy was in effect, and it was in effect after May. It was in effect for June and July, and for August until about August the 4th, when they said that abstinence policy was no longer in effect.
Until then, David says he is going to keep fighting and enjoy each moment he has with his friends and family. Tina House, APTN National News, Vancouver.
Winnipeg police say a missing persons case has likely turned deadly. They're calling on the public to help bring closure to the Metis woman's family. Brittany Hobson has more.
The family of Miranda Bell made an emotional plea during a media conference Wednesday morning.
We all as a family want to bring my sister home in the capacity that she comes home so that we can properly lay my sister to rest.
It's been nearly 2 months since a Metis woman was last seen in Winnipeg. City police previously requested assistance in finding Bell 3 weeks after she went missing. Now, they believe she is dead.
We're not confident that we're going to find Miranda alive. At this point, really, I wish I could say something different. We're really looking for closure for the family.
Bell's family says the 31-year-old was last seen at a residence in the south end of the city. Alexis Harvey says her sister made an alarming call around 12:30 a.m. on August 18th.
She called somebody she knew to be picked up from an address on Dudley Street. It was identified in the call that she was in distress and she was asking for help. She needed to leave the place she was at.
Police would not elaborate on what the call was about. They say the investigation is still ongoing.
Investigators have a sense as to what's happened here, but we're in the stages of an investigation where we aren't able to move forward with a conclusion.
Police are looking for a gray Dodge Caravan similar to the one in this photo.
Do we believe that Miranda may have been transported outside of the city into a rural area? Definitely that is what one of the avenues we're pursuing and something we suspect.
Investigators are asking residents and businesses in and around the city to check their properties and fields. Brittany Hobson, APTN National News, Winnipeg.
Winnipeg police are also investigating the city's 30th homicide. They were called to a home in the North End Monday morning. The victim has been identified as Darlis McKay. The 19-year-old was found shot and killed outside a home in the North End. McKay's family told media the young man fell victim to drugs and the gang life. Winnipeg police say the investigation is ongoing.
A candlelight vigil will be held in Hamilton, Ontario tonight for a 14-year-old boy who was stabbed to death in front of his school.
That's a big thing. Like, schools don't really care.
That's a result of bullying, and it shouldn't happen because someone died.
The community is still reeling, and many students are questioning whether the school is doing enough to prevent bullying. Devin Selve's mother says her son was stabbed and killed right in front of her at Winston Churchill Secondary School. She says he had been the victim of bullying. Two teens, a 14-year-old and an 18-year-old, have been charged with first-degree murder. Two other teens were arrested and have since been released unconditionally.
After the break, we'll bring you highlights from today's emotional season premiere of In Focus, where we were joined by a family desperately trying to get their child back.
And award-winning musician Jeremy Dutcher gives us his take on the current federal election. But first, a look at Thursday's weather forecast. Starting on the east coast, a sunny, warm day for Halifax with a high of 17, 16 in Fredericton, rain for Nain and a high of 10, 9 and showers for Cartwright, 17 under sunny skies for Montreal and Val-d'Or, 18 and sunny in Toronto, 17 under the sun for Ottawa, 17 and sunny in Thunder Bay, partly cloudy for Sioux Lookout, and 17. Plus 2 in Churchill and Thompson, 15 with a chance of snow for God's Lake, 4 with rain and snow for Ginley and Winnipeg, plus 1 with a rain-snow mix for Regina and Yorkton, 2 above with a rain-snow mix for Stony Rapids. Welcome back. Award-winning musician and activist Jeremy Dutcher says Indigenous peoples in Canada are being used as pawns to talk about politics. In an upcoming episode of Face to Face, Dutcher says you don't need to look much further than the recent leaders' debate for proof. Dutcher, who has been using the platform he's been provided over the past year to speak out, says he finds it offensive and repugnant.
I'm not working for a party. I'm not like, there's no part of me that is, trying to get some kind of interest forward. I'm just simply sitting as a young Indigenous person in this country, looking at the landscape that we have right now and saying, no, 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 because I don't agree with any of it. We can't even have proper debates about Indigenous issues in this country. We can't even get in the door at those debates. They want us to hold their microphones. So I just think we need to be doing a little better in 2019.
And for those of you in Winnipeg, Jeremy Dutcher is performing with an orchestra tonight at the Burton Cummings Theatre.
Today was the season premiere of APTN's In Focus. I spoke to a family who lost their son to CFS apprehension days after his birth. The reason? Mom had been in an abusive relationship with another man 6 years prior and didn't leave that relationship before her daughter was hurt. She lost that girl to the system, and when she had a baby with her new partner last spring, authorities came for him too. They've been fighting ever since to get him back.
It started off the meeting that I went to go to with my first lawyer. They said nothing about apprehending him. They just said there's a possibility, we probably won't. We will need to go to your house, do an inspection, which they did, which we passed it.
We've passed 2 home inspections now.
Yeah. 2 home inspections by 2 totally different agencies, and my daughter isn't home and our son was taken from me.
They've stated in court under oath that they have no reason for apprehension.
Right. So, and keeping in mind, I think this resounded with me when I heard this. You've got 2 other kids, one child who's out of province but who comes and stays with you, and you've got half care of a daughter. So for Child and Family Services to be saying, well, we have to make sure that this home is safe, kind of strikes me as, well, if you're concerned, why are these kids allowed there? Exactly. That struck me as odd to begin with.
Well, it was going good at first. The second, he wasn't even a day old, and the hospital social worker came in, talked to us, and he had even said that there was no order for apprehension of our child, that we shouldn't have to worry that if CFS were to come to the hospital, they would have to go through him. And they didn't. Every time my partner here left the room, the CFS worker would show up.
They came 3 times to the hospital room. I never saw them once. But they came 3 times. Somehow I was only gone 15 minutes at a time, and somehow they snuck into the room every time to get her alone.
So, but on what grounds did they take a newborn baby from his breastfeeding mom? So if they don't know, let's go to the court documents, which we have. And it shows that the caseworker in this felt that, quote, due to the resistance of the parents to cooperate in the process, I was of the view that it was reasonable and probable that the baby was a child at risk of serious harm. This is from an investigation that she did of the couple? No. Let's look again. Quote, because of the information that we had received in the intake module, after consulting with my supervisor, we both agreed that if the baby was to be returned home, he would have been at serious risk of harm.
Never.
Based on no investigation, just 6-year-old information.
Well, to me, all they've said is it's classified. They've taken my son based on an assault by somebody else, and they don't want to talk about it. They don't want to speak to me because they can't legally take my kid. So they just don't want to talk to me.
But they did legally take your kid. This
they sure did.
This has gone to court. Judges have said, yep, this is fine. Keep the baby in care. Like, it's legal.
It shouldn't be, because we have done nothing wrong. We have everything that we need at home. Always have, and we always will. We just want our children home.
Very difficult but important episode to watch, and you can watch the entire episode by visiting our website, aptnnews.ca. Coming up after the break, we're off to a festival in Woodstock in Oxford County.
But first, here's the rest of Thursday's weather forecast.
Picking back up in northern Alberta, sunny and a high of 9 for Peace River, +6 for Grand Prairie. 3 above for Medicine Hat and Lethbridge, sunny and 6 everywhere else. 12 under sunny skies for Victoria, Tofino, Campbell River, and Bella Coola. Sunny and 8 for Fort Nelson and Prince George. 4 is the high for Dease Lake. +4 with snow for Old Crow, 2 above and snow for Rock River. Sunny and 10 for Fort Liard and Trout Lake. Snow and 4 in Yellowknife. -1 with snow for Sax Harbor. +3 and snow in Paulatuck. -3 with snow for Baker Lake. 0 and flurries for Chesterfield. -2 with a rain-snow mix for Clyde River. -7 and flurries for Resolute. Welcome back. An exhibition of works from the Northern Ontario artist Benjamin Chichi is now showing at the Timmins Museum. Originally from Temagami First Nation, Chichi first captivated Canada's contemporary Indigenous art scene in the early 70s. CTV's Lydia Chubak reports.
Iconic original works from Ojibwe artist Benjamin Chichi are on loan at the Timmins Museum. Chichi first emerged onto Canada's contemporary Indigenous art scene with an exhibition in Ottawa in 1973. He declared himself a modern abstract artist with pieces such as these, saying he was only expressing his feelings, not his Indianness. He's also been quoted as saying he's created images of birds that people seem to like, and they paid the rent.
He was a groundbreaking artist back in the 1970s. Indigenous work was just becoming something that people were starting to talk about in Canada. Instead of just sort of siphoning it off to the side, it was really being started to look at as a movement within the arts field.
This woman dropped into the museum to see what was new and was pleasantly surprised to reconnect with Chichi's art.
I've seen his work so often over the years in one person's home, but just through museums. It's very soothing or very peaceful and natural. He really connects with the earth.
This one, entitled Friends, Chichi painted in 1974, and it's here from a private collection.
It's an image that speaks to Canadians, and it is the most reproduced Canadian image ever in Canadian art. So it's one that you're bound to have seen, and it's just one that's so simple yet so emotional for people.
Chichi worked for only 4 years and passed away in 1977. Benjamin Chichi Life and Legacy is the third major retrospective exhibition of the artist. A special evening is planned next week with the curator of the exhibit. His works will be here for the rest of the month. Lydia Chubak, CTV News, Timmins.
Jingle dress dancing, drums, and Indigenous artwork were all on display at this fall's gathering at Doors Open Oxford Woodstock. Organizers say this is a chance to open dialogue between Indigenous groups and the community. CTV's Zane Jinnah brings us this.
Jingle dress dancer Janice Wabi trekked 7 hours with her family from Tiskaming First Nation in Quebec for this year's Doors Open Oxford Woodstock. Dancing for over 20 years, she says interest in Indigenous culture is growing.
I think it's important that people know about our culture. It's a beautiful culture. We celebrate it all the time.
This fall social gathering is now in its 3rd year, with opportunities for the wider Woodstock community to engage with local Indigenous groups. This is the first time that the fall social gathering has been held outdoors. The last 2 years, it was held indoors in a high school. And it's making a difference.
Having fun, just interacting with people.
I'm learning a lot about my heritage, which I was not familiar with before, so this is very interesting for me.
There's been a lot of learning going on, and there's still more to do.
Cara Van Clavern with Oxford County Family and Children's Services says the event is part of reconciliation efforts. She says this year, the county started delivering Indigenous-led early-on programs.
And what we hope is that what we'll see is people seeing themselves in their own community and knowing that there's resources and supports and activities that they can participate in.
For Wabi, teaching her daughters to dance passes on important lessons about their heritage.
They're really lucky, I think, to be able to start that at a young age and be able to pass it on even to their friends.
Well, that's your APTN National News for this Wednesday. For much more, visit our website, aptnnews.ca.
That's where you can watch today's episode of In Focus on the child welfare system. You can also catch a rebroadcast at 10 a.m. Central right here. I'm Melissa Ridgen. Have a great night.
And I'm Dennis Ward. Have a great night. We'll see you back here tomorrow.